Riley, and today I'm going to be doing an intramuscular injection skills video for Nightingale College. I have all my supplies here. I have my patient, my medication, which is a morphine sulfate today. I have my alcohol swabs, my gauze, gloves, hand sanitizer, my sharps container, my trash can. I have my 3 milliliter syringe, and today for this demonstration we are going to be using a 22 gauge by 1 inch needle. So the first thing that I'm going to do is go over my provider's orders. My provider has ordered 6 milligrams of morphine sulfate administered intramuscularly, and so I'm going to go and make sure that I look at the EHR and the MAR in the order together. I'm going to go through the 6 rights of medication administration, which is right patient, right dose, right time, right medication, and right route, and right documentation. So I've looked all that over and everything is correct. So I'm going to gather my supplies and go to my patient's room. I'm going to knock on the door. My patient has told me I can come in. I'm going to introduce myself to my patient. Hi, my name is Brittany. Today I'm going to be your nurse. How are you doing today? That's great to hear. I am going to be administering some morphine sulfate for pain today. Before I do that, I'm going to close the curtain and the door for my patient's privacy. I'm going to ask the patient to please state their full name and date of birth, and I'm going to verify that with the wristband, and I have the correct patient. So I'm also going to, at this point, verify with the MAR again my medication to make sure I have the correct dose, which is 6 milligrams. What I'm given today is 4 milligrams per ml, and I've done my calculations, and that came out to 1.5 milliliters of morphine sulfate. So I'm going to perform my hand hygiene and place my gloves on. I'm going to educate my patient. We're going to be giving you some morphine sulfate today for pain. It acts with the pain receptors to help reduce the perception of pain. When I give you the injection, you could feel some slight burning or tingling in the area. That is normal with every injection site. Stinging is also normal. Some common side effects would be drowsiness or constipation, and some adverse side effects would be difficulty breathing or hives. And if you have any of these side effects present, please let me know immediately. So I've done my safety check. I've looked over the MAR to verify my provider's orders, and now I'm going to uncap my medication and verify it again with the MAR, and I'm going to get my alcohol swab, and I'm going to clean the top of my vial. This needs to air dry, so as I'm air drying, I'm going to prepare my syringe and needle. Again, this is a 3 millimeter syringe, and I have my 22 by 1 inch needle. So I'm going to uncap that and twist that on and get my trash out of the way. Without uncapping the needle, I'm going to draw up 1.5 milliliters of air. And now that my vial has air dried completely, I'm going to uncap my needle. Oh, that's big. And I'm going to stick that into my vial and administer the air. I'm going to invert, and I'm going to make sure that I'm not getting any air bubbles, and I'm going to slowly get to 0.5 milliliters. And it's okay to go a little above so that you can flick the air bubbles out and make sure that you are getting the correct dose with no air bubbles. Okay, so I am good. I have no air bubbles at this point. So I'm going to take my vial and place that down, and I'm going to show the camera. I have 1.5 milliliters. I'm going to scoop the cap using the one-hand scoop method, and I'm going to cap that. At this point, I'm going to look at my patient's skin integrity. I'm going to ask them to roll over on their side, and I'm going to be doing this with the V method. So I'm going to place my thumb towards, this is the trichanter area. I'm going to place my thumb towards the groin, my pointer finger on top of the posterior or anterior posterior iliac spine, and my middle finger is gonna go towards the iliac crest. And at this point, I have a V. Okay, we're gonna do that again. So, because I can use a alcohol swab for my marker. So I'm gonna place my hand on the trichanter. I'm gonna place my thumb towards the groin. I'm gonna put my pointer finger towards or on top of the anterior posterior iliac spine, and I'm going to put my middle finger towards the iliac crest, and I'm gonna place my marker right here in the V. Okay, so we have our marker. My patient's skin integrity is great. There's no open wounds or rashes or bruising anywhere. I'm gonna slightly palpate the skin and see if there's any tenderness or pain, and my patient is okay. I'm going to grab my alcohol swab, and I'm going to clean the area in a circular motion, going 2 inches out from the injection site, and I'm going to replace my marker there. It's very important that we let that air dry, not wave it or blow on it, so that it can, so sterilization is not broken. So I have my marker there. I'm going to take my non-dominant hand, and I'm going to put that up. Oops. I'm gonna put this up against that, and I'm gonna pinch down. Well, first I think I'm gonna uncap my needle. I'm gonna put this down, and I'm gonna pinch, and I'm going to remove my marker at the same time. Now this needle needs to go in at a 90-degree angle. It needs to be administered 10 seconds per milliliter. Once that is administered, we're going to, injected, we're going to leave that in for 10 seconds. We're going to pull that off and stick our gauze pad there. It's important not to put too much pressure or massage the area. I'm gonna dispose of my needle in the sharps container, and I'm going to monitor my patient to see if there is any bleeding. If there was continuous bleeding, then we could place a bandage. Right now, my patient looks good. I'm gonna ask them if they have any questions for me, how they're feeling, if they're doing okay. And then I'm gonna get ready to document. I'm also gonna lower my bed to the lowest position, make sure my patient has the call light in hand in case they start experiencing any reactions, they can get a hold of me. I'm going to get ready to document. So I'm gonna take my gloves off here, and I'm gonna clean up my mess. If this was done outside of the patient's room, then I would label the medication with their name and date. I'm gonna go document the right patient, right medication, the dose, the time, the route. I'm going to also document the injection site. And then I'm going to perform my hand hygiene. And I think I'm good to go. Thank you.